And this morning, I've been joined in the studio by the board chair of Stop TB Partnership Ghana. He is Mr. David Kwesi Afreh. And we're going to have a conversation about tuberculosis, basically, and what we can do to strengthen the TB response through multi-stakeholder partnerships. And of course, I've been joined in the studio by the board chair. Good morning, sir. How are you doing?
Good morning, Stephanie. It's a beautiful morning.
Yeah, it
and
is.
You're looking sharp.
Thank you. You're
Thank
looking
you
good
so
as
much.
well.
We give the glory to God.
Right. So, as the board chair of Stop TB Partnership Ghana, what does Stop TB Partnership Ghana comprise of?
Oh, thank you so much. I think it's important I say a very big thank you to my global chair, the Prime Minister of India, and also the Vice Chair, Chief Obiefuna, who is a Ghanaian Nigerian.
Okay.
It's important to say good morning to all my board members, and then also to the program manager of the National TV program. So just to say good morning to them first before I say anything.
No problem.
The Stop TB Partnership is a multi-stakeholder platform.
Okay.
It's principally more of civil society organizations called non-governmental organizations. But it is important for you to know that the board is comprising of 4 sectors.
Okay.
We have the civil society, that is NGOs, and then you have the public sector represented by the National TV program. And so the National TV program manager is a member of the Stop TB Partnership Board. And then you have the private sector currently being represented by Dr. John Nkrumah Mills, who is also the president of the Ghana Citizens Association.
Okay.
And we have the academia also represented on the board.
Okay.
And so currently we have Professor Ernest Kenu of the School of Public Health, University of Ghana, as a member of the board. And so this is a multi-stakeholder board that takes decision to ensure that we are able to support the National TB program in finding especially the missing TB cases in Ghana.
Right. And Stop TB Partnership Ghana, what would you say is your ultimate goal or your core mandate?
To end TB in Ghana. We want to see Ghana free of tuberculosis. And the global vision is what we are all working with. The goal is that by 2030, we should end TB. We must end TB by 2030, which is about 7 years to go. And so it is important this tuberculosis. And this is why we are looking at the multi-stakeholder approach to ensuring that everybody play a role. Private sector plays a role, the academia is doing research, the public sector is providing all the logistics that are needed to ensure that we have speedy diagnosis, bringing his voice onto the table to make sure that all the needs, that all the deficiencies are being filled, all the resources that are needed are being provided, and to ensure that we are on
all hands on deck.
All hands on deck to make sure that we are ending it.
Okay, and in the next 7 years, looking at 2030, 7 years from now, do you think it's feasible?
Yes, we can.
Okay.
You see, when COVID came, the whole was on, and the president's famous press conference, is it press briefing? And he announced $100 million facility to combat COVID. And we have indeed combated COVID. If the president declared tomorrow that to end TB 2030, I am providing a budgetary allocation of even that $50 million. That's a big stride to support other actors. We should be getting to the end. In fact, the TB program needs a minimum of $18 million a year to run a very effective program. A very effective program means that all the supplies that are needed in ensuring that we have smooth diagnosis and smooth treatment flow. Because every person that is TB must be found. And once you are found, must be. And so the process of finding you, there are logistics that are needed. And the process of treating you to a successful end, to be cured, there are logistics that are needed, financial and non-financial. There's a machine called, for example, Gene Expert machine, which is needed in every part of this country, at least every district in this country, to ensure that anybody that we are able to presume as TB have easy access to be diagnosed, and then we are sure that this person is TB, and then we treat the person.
But have you had support from government so far?
You know, government has the health system. As we speak, we have much more of resources coming from the Global Fund. The Global Fund provides, for example, for the past 3 years, we're talking about $22 million from the Global Fund. Because of the emergence of COVID, additional funds have come. But if you are looking at the next 7 years, where Ghana is more dependent on the Global Fund, Global Fund is allocating so far $18 million for the next 3 years. When in actual fact, we will need $18 million a year.
Okay.
The allocation we are now having is 18 million for 3 years. So there is a huge deficiency. And so, of course, Ghana has the Ghana health system, and all health facilities are available.
Okay.
But are all health facilities having diagnostics machines?
Okay.
So that when you go to your district, if you go to your village, how close is the diagnosis facility to you? So that you can have easy access if you have the symptoms of TB. I hope you understand.
I do.
And so, government is playing their part in the normal health system, but we need to make sure that we up the game.
Okay.
Because the usual, how sensitive are the doctors in the hospital? How sensitive are the nurses?
Okay.
The NTP, the National TB Program, is by the Global Fund, ensuring that we have what we call intensified case finding at the facility level. In other words, somebody is in charge of TB at the facility, trying to play a certain role to ensure that anybody that passes through the hospital system that is carrying TB is found. How stringent is that?
All right.
Okay. All right. Now, if you go to a facility where you don't even have the diagnosis, it means when they collect the sputum of the presumed TB person, that sputum may have to be transported to another facility. So you have a long process of conveying or maybe storing that and conveying the sputum to another facility for it to be diagnosed before you come back to know the status of that specimen, and then now looking for the patients to communicate to
kill that person.
You understand? So the presence of logistics is very important. I think what are lacking is that we need to make sure that we have flow of supply. Gene critically important. Private hospitals, public hospitals, they must provide. In fact, we are going to end TB in 2030. The development partners have never called on them in this manner. But I'm saying, if you have WHO, you have USAID, you have UNAIDS, you have mentioned all of them. The private sector, the media. If every development partner can adopt a particular hospital that is not having the machine that diagnoses TB more efficiently, which is the GeneSpec machine, and provide one for such machines, I mean for such facilities, we will be expanding the amount of diagnosis. You know the role civil society plays? Because we know that there are hard to reach communities, people who are far away from the facilities. And so what civil society does, for example, is that we go from community to community, house to house. In the cities, you go to the slums where people are smoking and drinking, and it is not easy for normal Ghana Health Service staff to penetrate to do health screening. So civil society is able to have the capacity, and then they go into these areas and are able to do screening. So you collect the sputum from these people because you cannot refer them to the hospital. And then you go to the nearest GeneSpec machine and then get the screening done, and then you convey the results back to those places. And if any of them is positive, you are going to make sure that you link the person to a Ghana Health Services facility to undergo treatment. So for example, before you go into the community, you need to have the sputum containers. Used to collect the specimen. If you have shortage of specimen, you go to the community, you can't. And you go to the facility. if the cartridge is time that the cartridge is short. For those who made and this sometimes procurement and all of that, it takes a very long time for them to be able to do certain things. I think that this is where it is important for the president to come in, because it is possible for the president to allocate resources and dedicate them to such diseases, and then the rules that govern it will be a bit relaxed, since his accent is on it, and he must get involved. So if they are having difficulty even negotiating where these cartridges come from, a call from the president of your nation to a private company somewhere is enough to say, look, if the president has spoken and given assurance that supply this thing, will pay you in the next 1 month. It is done. But if you have only the minister, you have people who may only complain, the process doesn't go through.
I believe and I understand so much the roles and responsibilities from the government, but with the general public, I believe that you have run some awareness creation and education. How is the general public soaking in this kind of education to prevent themselves, at least infecting themselves with TB?
Oh yes, you see, once you are moving from community to community, and you are doing education, people begin to understand. You know, the Bible says, "My people perish for lack of knowledge." Once you are providing appropriate and accurate information to the people's salvation, they know, they become aware that, look, TB is real, and there are families that are having such people living with the disease among them. And so we are beginning to do a lot of counseling, and once people are beginning to know that, yeah, this is real and there is treatment for it, yes, they are beginning to respond. And so you could, an NGO in a community, you'll be surprised, we'll have a call that, oh, I presume there is this person that has been coughing for some time. Can we check to see how we can help him? This thing happened. So I think it's also using the larger media, the media platform like your platform, which goes to many more people to do a lot more of the details doing that from now until 2030, so that we can an end to TV in the geographic space of Ghana. Unfortunately, you are not able to end TV in only your country if the others around you are not ending it, because TV can move from one country to the other.
We'll come to how it can spread from. But in recent times, you're creating awareness on how the general public should give attention and resources, at least 10% as we give to COVID-19. Just 10%, I'm trying to analyze. Do you think that, or would you say that the TB is not as scary, as dangerous, as deadly as COVID-19?
In Ghana, it's expected that we find 45,000 TB cases every year. That is a surveillance report. If you take every 100,000 population, you are talking about almost 200 annually. So Ghana is supposed to find 45,000. And we are finding, we have not been able to achieve finding 20,000 in any of the years. Now, statistics show that about 15,000 people die every year. Now, if 15,000 people are dying, when COVID came, how many people died in Ghana? 2020, 2021, 2022. You understand? TB is a killer disease. The only difference between the TB and COVID is that when COVID attacks you, it has a speedy gestation period. And so within a couple of weeks, you are already sick, and the symptoms come with severity, and then you are about to die if no treatment is given you. TB is a slow killer. So everybody in virtually the Sahara region, you and I are exposed to TB, and so everybody is exposed to TB. You need the TB now needs you to have a poor immunity, and the moment your immunity, your health, general health condition is not good, and your immunity is going down, TB can just come out. Okay, and so if these are the numbers of death, and these are the numbers that we are supposed to be chasing, and we are not getting them, You know how many people are dying of TB, but the data will not tell you the true picture. Because there are many more who didn't go to the hospital,
right,
but they died in their homes. That old man of 70 years, 65 years and above are in the villages in one room somewhere, coughing for so many months, and the families have rejected them, and they are dying every day, and they are being carried to the burial grounds. Who knows? And these people have left the disease in their families because it's infectious. And so it is very scary. And this is why the president of Ghana, of course, I salute him.
Yeah.
He participated in the 2018 high-level meeting on TB in New York and signed on to certain targets. You have multi-drug resistant TB, you have childhood TB, you have latent TB, you have TB among all populations. And so various targets were set, and he has committed, the president has committed to making sure that when he comes to Ghana, he will ensure that he tackles TB, put TB on his own agenda, and make sure that there is accountability for us to end TB at 2030. The question is, when he came back, what has he been able to do? I want to call on him at this moment.
Right, and hold him accountable.
Mr. President is back.
That's your camera.
Mr. President came back from New York in 2018 and is expected to form a multi-stakeholder accountability committee or a platform that delivers accountability to his office. That committee is not working. Who is currently the chairman? When was the last time that chairman spoke to you, Mr. President? What have they told you is the challenge of the program? It's important that His Excellency Nana Addo Dankwa Akufo-Addo comes to the aid of the program, the National TB program, to make sure that all supplies that are challenges are being supplied, all financial needs are being fulfilled, and that we are able to make sure we end TB by 2030.
By 2030.
I'm using this medium again, Stephanie. In 2023, September 23rd, we expect the president to go with the program, the civil society actors, to New York again for this year's annual, high-level meeting on TB, and that will happen on the 23rd of September. We expect that he will be there again for us to rejuvenate the platform of ensuring that he comes back home better, informed on TV before he finishes his term of office very soon.
I believe the signs and symptoms of TB are similar as COVID-19. I mean, the fever, the cough, the fatigue. You sweat profusely at night when you have TB.
Exactly.
But then, who's at risk of developing or infecting TB?
Everybody's at risk. You see, that is the more reason why you have the GCP. You have the vaccine for even children. So you realize that children who are under 5 years also even take a vaccine against TB. It can even attack a child.
Right.
Now, statistics have shown, interestingly, that ages of 24 to 35, both male and female, are actually in a higher risk. I mean, the data we have, the people who are on treatment, and when you analyze the statistics, you have more people in that range, interestingly. As to why that is so, we need to, I don't know. You think you are, or you are strong. You have to be, you'll be surprised. Let me give you a typical example. Everybody's at risk. My brother, one brother of mine, who works in one of the prestigious banks in this country. I mean, it's a senior man of between the age of 40 to 50. And this is a man that is cool to go in life. It was during COVID. I salute him. He called me and said, David, I'm having some cough. I don't understand. I said, you know my work. And I linked him up to one of the facilities in the country. He came back with a result and it was positive. I called the facility. I said, put on treatment quickly. And he was on treatment for 6 months. This is. So if you don't take that, you think because you dress neatly and you are in a very cozy environment.
You don't transact business.
Everybody's at risk. It doesn't matter the office you are in. Whether you are in the House of Parliament or you are in the House of the President or you are in my father's house. Personal house or in my community, no matter your age. But you see, it also means that people with more people more at risk are people who have problem with immunity. That is what it's supposed to be. So people at the age of 55 going, naturally you are growing and your immunity is going down, your eating habit is changing, and you are not able to exercise and all of that. And so that age is a very risky age that you have more people coming out for TB. As to why the younger age also is now becoming pronounced, maybe because of a lot of drinking and smoking, which breaks down your immunity, and so the youth are at risk. So it's important for the youth to watch. Now, another group that I need to mention is the persons living with HIV. If you're a person living with HIV, then it's about 42% you are likely to die of TB if you do not take very good care of yourself.
But your immune system is weak when you have the virus in you.
Your HIV is human immune virus, and for you to have AIDS, it means that the virus has multiplied over the years without you suppressing them. This is why the government has an intervention called the ARV. I mean, ART, we have the antiretroviral therapy. So these are drugs that are able to give the patient opportunity to suppress the virus so that the virus become virtually inactive in your system. So you can live your life normally. That is why every person in Ghana needs to know their HIV status. If you're going to end TB also, everybody must know their HIV status. And so that if you know you are HIV, you go on treatment. So test for HIV, go on to treatment, and then you are, by going on to treatment, you're also preventing TB. I hope you're getting the connection.
I do get that as well.
The reason is that when your immunity goes down, you see, HIV is human immune virus. So it's a virus that attacks the immune system. So, and it's the TB needs the immune system to go down for it to come up. And so if you are a person that already has a virus that is principally attacking your immune system, then you are more likely to be TB. And this is why persons living with HIV who know their status need to continually screen for TB anytime you cough, anytime you have regular sickness like the malaria, you have fever consistently, maybe this week you don't feel well, the next week you don't feel well, you have cough, you cough for more than a day or two. I mean, for me, I say after 24 hours of a cough, if you don't see it coming down, it means that your immune system is not able to contain reversal.
And you're coughing with pain.
And you are coughing with pain, especially when the cough is coming out of your lung. You can feel that your lungs are involved in the virtually feel that you are coughing something out of your lungs. And so that is a possibility. You are coughing and you have pains
in your ribs.
And you cough and you have blood stain. These are all indications that you could be suffering from tuberculosis. You go for treatment. You go for testing.
I have 4 minutes to wrap up. Say, how can I actually spread TB to another person?
Oh yes. Now, if I am TB and I cough, as we are talking, actually, the droplets coming out of our mouth, the air is saturated, and then that is it. That is why it is actually, we know that almost all of us
are prone to that.
We have the bacteria entering us, but because our condition of life is not deteriorated, the TB hasn't come up. And so that is why we need closed environment like the one you and I are in. And this is why you need to be sure, for example, if somebody is coughing, the person shouldn't be with you in one room. I mean, you need to need to wear the nose mask. So it's not just COVID, it's also TB, wearing the nose mask. If you are suffering, you are coughing, it's just important for us to make sure that
we are safe.
We are safe.
Finally, say, what does Stop TB Partnership Ghana have in the pipeline?
Oh yes, so we of course, from now till, like I said, to 2030, we want to make sure that we have various activities being done that includes media engagement, that includes engagement of the Minister for Health, Minister for Finance, Parliament. We are looking at forming even a caucus in Parliament where you have MPs that speak for TB. I mean, we hope that with this we will generate the interest among TB, among parliamentarians who should be able to scrutinize and be interested in how much allocation is coming to TB. Because this is a disease that we need to make sure that we end. Can we make sure that we meet with the President of the Republic, whether now and beyond, whoever becomes the next president, we will be making sure that you put TB on your agenda. The first ladies, a lot of children are dying of TB.
Yeah.
Can we get the first ladies to become interested in childhood TB?
Okay.
So they galvanize resources around that to make sure they become interested to help their husbands. I mean, end TB by 2030.
Thank you very much, sir, for making time and joining us in the studio, and all the best in your agenda. We had a conversation with Mr. David Kwesi Afreh. He's the board chair of Stop TB Partnership Ghana.